Our second speaker is Linda Armitage-Nagrant, and Linda is also a native Detroiter. So 2 for 2, almost as good as the Tigers, or maybe even a little bit better. So Linda is a social worker, and she has been working here at Neighborhood Services Organization for 27 years. She works in the Adult Aging and Adult Services Division. She's worked in the field in aging for more than 30 years in the Detroit area. She's a very hands-on person with a giant heart who knows a lot about adults and mental health, and she wants to engage with you directly right now, so please welcome Linda.
I think that's good. Is that good? Can you hear me? Good afternoon. I'm here to talk to you a little bit about stress, and this is really stressful. If talking in a group of lovely people like yourself, I am relaxing and getting more comfortable. I'm here to talk to you a little bit about how stress impacts persons that have mental illness. Persons with mental illness live in a world of mostly people who are uneducated about mental illness, with a long-standing history of describing mental illness as a character flaw or weakness. People with mental health challenges have different signs and symptoms that can look different in different people. Some of the common challenges that people face that have mental illness that cause stress are changes in their mood, if you know persons that have depression or anxiety, changes in the way they see things. Some people with schizophrenia or bipolar disorder who have some areas where they think that things aren't really what is going on around them. Obsessions, people who get so caught up in their thoughts that they can't branch out or they can't break away. Fear of the disease, fear of people not being around them. That's very stressful for persons that have mental health challenges. And also feeling of anxiousness, feeling that they're not getting their needs met, feeling that they're not getting their point across, feeling that people just don't understand. Mental health challenges can happen to anyone and at any time. There's no race, age group, nothing. Mental health challenges can happen to all of us at any point in time. If we've suffered a loss, if we suffered excessive changes, those are stress. Persons with mental health challenges connect with stress and anxiety. It's their best friend sometimes. These stressors can be because of the diagnosis they've just had. They may have not known that they were behaving inappropriately or wrong, or some of the things that they did to maybe make people uncomfortable or push people away. It can cause guilt, shame, and even depression. Then there are our social ties, friends and family that we count on. We can support our loved ones with mental illness by educating ourselves, working as a team, helping find resources, encourage treatment, and convey hope. The next is stigma, and this is a big stressor for people with mental health issues. It doesn't matter what age group. We still haven't reached that area where we're all that comfortable with discussing or working with mental health issues. It's a really big problem still. We need to educate ourselves. We need to understand that this is this is something that can be handled and managed and can be supported. People with mental health issues get stressed out because they feel that people think that they're less able to function, work effectively, or cannot be trusted. Another stressor for persons with mental health issues is problem accessing health care, lack of coordinated care, especially those with low incomes or lacking support. Poverty. Not being able to pay for services or medication. That can be a real stress for people who don't have access that readily at their beck and call. The other thing we need, and people get stressed out, is we need to increase our physical activity when we're stressed out. It pumps up those endorphins, and it makes our brain feel much better. Another stress is poor nutrition and diet, and other medical physical conditions such as heart disease, chronic pain, kidney disorder, just to name a few. Let's go over, I think the doctor did go over a little bit of some symptoms of stress. Some of them are not feeling yourself or feeling detached from people. Your mind racing, your heart racing, some panic, just like I had a little bit ago, fear of the environment, and it impacts our sleep and appetite. The important thing about stress is to practice good self-care. Self-care is very important, especially with persons with mental illness. We have to pay close attention to our stress levels and help them to decrease. Some self-care ideas are maintaining a good sleep cycle, form and practice good relationships, educate. The more we educate, the more we're empowered. The more we're empowered, the more we're able to handle things a lot better. Accept help when needed. A lot of persons with mental health issues don't want to ask for help. They don't feel very comfortable. They don't know how to ask for help. And again, increasing our physical activity, that's one of the most important things we can do to help reduce stress. Thank you very much for your time.